Hello everyone, this is Dr. Huma Ibrar. I hope so you all will be enjoying your good health. So today's video is basically on MCQ file that is present in my free material link, but the key for this MCQ file is not present in this file. So today we'll try to solve these MCQs and figure out how to prepare for MCQs basically. So the first one is dash can be defined as an interaction or complex relationship between the health condition and contextual factors. So the options are disability, option B is disablement, and option C is disease, option D is illness. So now, what are contextual factors? Contextual factors are basically the environmental factors or the personal factors. So, the answer for this MCQs is option B, disablement. Option B, disablement. This is the answer for the first MCQs. Option B, disablement. Let's move towards second MCQs. I hope so everyone could solve this MCQs easily. This is SOAP format can be elaborated as option A is subjective objective assessment plan, option B is single objective assessment plan, option C is symptom objective assessment plan, option D is statement objective assessment plan. So the correct option for SOAP format is option A, subjective objective assessment plan. Option A, subjective objective assessment plan. So this is the correct answer of second MCQs. So let's move towards the third MCQs, that is dash is defense mechanism to alleviate the anxiety and pain associated with disability and illness. So uh, option A is internalized anger, option B is depression, option C is externalized hostility, and option D is denial. So what could be the defense mechanism to elevate or to decrease anxiety or pain that is associated with disability or illness? So the option for this is option D, denial. The third MCQ's option correct option is denial. Dash is defense mechanism to alleviate anxiety and pain associated with disability and illness. The correct option is denial. Basically, denial is denying the reality or denying the external factors that could basically trigger anxiety and pain. Let's move towards the MCQs 4. Individual with dash personality need to be in control and need things to be done in a particular way because of rigid perspective values. Individual with dash personality needs to be in control and needs things to be done in particular way because of rigid perspective values. Option A is passive aggressive. Option B is authoritative. Option C is perfectionistic. Option D is compulsive. So the correct answer for option for fourth MCQs is option B, that is authoritative. Now let's move towards for fifth MCQs. Normal range of newborn blood pressure. Normal range of newborn blood pressure. Option A is systolic 140. Option D, and diastolic 90. Option B is systolic 120, diastolic 80. Option C is systolic 84, diastolic 43. Option D is systolic 52, diastolic 30. So the correct option for this is the normal range of newborn blood pressure is basically systolic 52 from 52 and diastolic 30 from 52 to the 30. So let's move toward the sixth MCQs, that is the transfer of heat by movement of air or liquid is called as option A radiation, option B conduction, option C convection, option D evaporation. So the correct option for the transfer of heat by movement of air or liquid is option C convention. Option C convention for sixth MCQs. Note down the answers of these MCQs, please. Okay, let's move towards the seventh one. In hyperventilation breathing, dash type of breathing pattern is seen. In hyperventilation, which type of breathing pattern is seen? The first one is slow breathing. Second one is deep, rapid deep breathing. C is rapid shallow, and D is sighing. So the correct option for hyperventilation breathing pattern is option D, that is sighing. So let's move towards the eighth MCQs. That is Korotkov's sound series contains. Now, what are Korotkov sound series? These are basically sounds between systolic and diastolic during measuring the blood pressure. Sounds between systolic and diastolic. Okay. So the the options are option A 3 sounds, option B 4 sounds, option C 5 sounds, and option D 6 sounds. And the correct option for Korotkov's sound series contains 6 sounds. Option D is correct for 8th MCQs. Option D is correct for 8th MCQs. Note down the answers. So let's move towards the 9th MCQs. These are the joint receptors except one. Option A is Ruffini endings. Option B is Pacinian corpuscles. Option C is Paciniform endings. Option D is Golgi type endings. So the correct option for MCQ 9 is option C, Paciniform endings. Paciniform endings is the correct option for MCQs 9. Let's move towards next, the 10th MCQs. Loss or the absence of sense of vibration is called as option A, palinesthesia, option B, allodynia, option C, dysthesia, option D, atognosia. Okay, loss or absence of sense of vibration is basically called palinesthesia. Option A is correct for MCQs number 10. Let's move towards the MCQs 9. Accessory joint motion grades are dash in number as per Stanley Paris scale. As per Stanley Paris scale, how many joint motion grades are there? Accessory joint motion grades. Option A is 0 to 3, option B is 0 to 4, option C is 0 to 5, and option D is 0 to 6. So the correct option for MCQs number 11 is option D, 0 to 6. Let's move towards the MCQs number 12. To check C7, we take dash muscle tendon reflex. So to check C7, dash muscle tendon reflex is needed. Option A is biceps, option B is tricep, option C is brachioradialis, option D is flexor digitorum superficialis. So the correct answer for C7 muscle tendon reflex is from triceps, option B, from triceps. The correct option is B for MCQs number 12, that is triceps. Let's move towards the 13th MCQs. Generalized muscle weakness is associated with cerebellar ligand called as option A is akinesia, option B is asynertia, option C is asthenia, option D is ataxia. So the correct option for MCQs number 13 is, that is generalized muscle weakness associated with cerebellar ligand is C, asthenia. Correct option for MCQs number 13 is C, asthenia. So let's move towards the 14th MCQs. The state of semi-consciousness. The patient's legs responsiveness and can be aroused by intense stimuli is callness. The patient is in semi-consciousness, but the patient could be aroused by intense stimuli. So the option are option A, stupor, option B, abundation, option C, lethargy, option D, semi-coma. So the correct option for this is option A, that is stupor. So let's move towards the 15 MCQs. In upper motor neuron lion scapular spasticity pattern attained by dash muscle involvement. Options are deltoid, B supraspinatus, C rhomboids, and D subscapularis. So the correct option for MCQs number 15 is option C, that is rhomboids. So let's move towards the MCQs number 16. Bow and arrow response is seen as dash and primitive reflexes. These primitive reflexes are very important for any license exam, so prepare for them also. The option A is startle reflex. The option B is asymmetrical tonic neck reflex. Option C is symmetrical tonic neck reflex. And option D is symmetrical tonic labyrinthine reflex. So the correct option for bow and arrow response seen in A, asymmetrical tonic neck reflex. So let's move towards the MCQs number 17. That is Birch balance scale contains dash functional tests, task test. Birch balance contains dash functional task test. Option A 13, option B 14, option C 15, option D 16. So the correct option for 17 MCQs is B 14. Now let's move towards the MCQs number 18. Dash is an abnormal potential in EMG electromyography. So the options are fibrillation potential, fasciculation potential, positive sharp wave, and all of the above. So the option for MCQs number 18 is all of the above. So all of the above are basically abnormal potential in EMG. Then let's move towards MCQs number 19, and that is second last MCQs. Level of consistency refers to option A, validity, option B, generalizability, option C, reliability, option D, normality. So the correct option for loss of consistency is refers to option C, reliability. So the correct option for MCQs number 19 is reliability, option C. Let's move towards the last MCQs, MCQs number 20. Lower limb NCV, that is nerve conduction velocity for sensory examination, commonly done in dash nerve. So nerve conduction velocity for lower limb and for lower limb sensory examination is commonly done in dash nerve. Option A, peroneal nerve. Option B, posterior nerve. Option C, obturator nerve. Option D, sural nerve. So the correct option for D is for the correct option for MCQs number 20 is D, that is sural nerve. So lower limb nerve conduction velocity for sensory examination is commonly done in sural nerve.